All right, BCC tribe. So we're going to demonstrate in this video how to properly use your Denne roll. Remember, the Denne roll is designed to get this neck curve back. Many people, the heads facing that direction, have lost their neck curve forward. And so the placement of the Denne roll is typically in the lower cervical. It can vary, but you're going to place it in the lower cervical to help bring the arc back in that neck. We want to see the curve come back. And so there's various sizes to the Denne roll. When you've been sized in the office, this is a large, it's gray. We have a medium, which is white, and we have a small, which is yellow. So Abigail, lay back. I'm going to place the Denne roll right on that spot, and you're going to relax your head over top. Now, what you're going to notice right away is that her head now has an arc in it, and that's exactly what we want. So this wedge is placed exactly how I want it, and it's right below that dimple, and she has an arc over the top. Her head on this table is currently hitting, which is fine. Many of you will have a gap to where, half an inch or quarter of an inch, maybe even an inch and a half off of the table or the ground. Preferably do this on a flat surface, not in the bed. And we're elevated for the sake of this video, but I'd like this to be on a hard ground. And what happens when you're on the Denne roll, inside your box, there's a tracking sheet, and it's going to tell you how many minutes to do. It's a 7-day-a-week exercise. So if you miss a day, I want you to get back on it. You're going to start with 3 minutes, and each day increases by a minute until you're up into the 15 to 20-minute range. If you're having any neurologic symptoms like burning, shooting pain, vertigo, dizziness, please tell the doctors. Oftentimes, it's just a placement of the Denne roll. It's in the wrong spot. Sometimes you can't do it, or we'll have to change it to a different Denne roll. So this is the large Denne roll, and you would lay on this until your minutes are up. And what happens is many of you, like I said, would have a gap in your head in the floor, and over time when you're laying on it for higher minutes, like 10 to 15, it's going to start hitting. That's really good. When your head and you're laying on it, let's say you're a week or two into it and your head just goes clunk and hits the floor, please tell the doctors. That's really good. That means the ligament is conforming to the shape that we want it, and we're going to change the position because the Denne roll can be changed up as well. So this is the placement of the large, medium, or small, all the same way. If you've been given your wedge Denne roll, which is known as the thoracic Denne roll, it's a little different placement. So Abigail, if you could lift your head up. This one would go pointing like this flat part, pointing down towards your bum. It wedges underneath the shoulder blades, and you would lay back, and that's going to force the shoulders back, and the head will fall back. Now, if you've got that one, many times you'll feel the head be off of the floor by a considerable amount. We recommend that you can put a pillow on a flat surface to just rest your head until you get used to it. The biggest thing is the pillow should not be pushing the head forward. So if you notice that your head is going this direction, that is going to be counterproductive to what we're trying to accomplish. And then as you get really good at the Denne roll, the thoracic, then you can start to remove the pillow as you're laying on it long enough, and you can advance in that position. But this is a general overview of the position of the Denne roll. Anytime you have a question on placement, please don't hesitate to talk to the doctors. That's our job. Or if you have an issue with a neurologic flare-up, that kind of thing, shooting pain down the arms, please tell us. So this video should be very useful for you. And any other questions, like I said, see your doctors. Enjoy your day.